guys. Today we're going to talk about a very important disease and a very important topic. So what is it?
It's the breast cancer. The breast cancer. The breast cancer is a kind of cancer that develops from the breast tissue.
Exactly. Now, signs of breast cancer.
For every disease, we have very important signs. Those signs are, we can all notice them from the appearance of our body.
Because it appears on you. So those are the signs. You know from the signs that you have this disease. First of all, we have a change in the breast shape. It means like the breast shape gets smaller or even bigger.
A dimpling of the skin, it's like kind of changing in the skin, and we have fluid or liquid that comes from the nipple.
Nipple is the front part from the breast where the baby gets food.
A newly invented nipple, there is a small body that appeared newly, not many, you have it in the past.
A red or scaly patch of skin. It means like your skin could have like some patches or like
red bodies or red changes,
you know,
and a lump in the breast.
Okay.
And in the case of spreading the cancer into all your body, there is, for addition for those, the last signs, we have four signs.
Excuse me before you begin. Any cancer, ignore about like breast cancer, not only breast cancer, any cancer start in a place and then it's like spreads and spread all over the body. If we didn't like end it from the beginning of it. So when this breast cancer spread, or in general,
we have four signs.
Yes.
Bone pain,
it means like it's pain in your bones.
Swollen lymph nodes. This sign is the most important sign in every kind of cancer, because the lymph nodes can affect it very easily when you have a cancer.
Shortness of breath, it means like shortness of breath.
And if you walk,
you don't have like long breath to do things as usual.
And the yellow skin. The mammogram is a newly invented device. It was invented so recently. This device can help us to have a radiation photo for every part of the body, but it's used most of time for the breast. Here we have a photo from the mammogram. It gives us a photo for a normal breast. There is no new body, there is no cancer. And in the left,
we have mammograms showing a breast with cancer. We can see here from this little body,
tiny body, and it's mysterious. That gives a sign. It's maybe be cancer and it's maybe not.
But I want to tell you something before we do like a checkup on mammogram. Mammogram is dangerous. Like we don't always.
It has its benefits and it also has its drawbacks.
So this,
if it's not necessary, we are not obligated to do it. We can do it every week, every month. It's once a year or twice a year.
Of course.
Here we have the risk factors of females. That means not just females can be affected by breast cancer. Also males can be injured by breast cancer, but it's a very low rate.
Yes. First of all, we have obesity. It means like to have much weight. It means like you're getting too fat. And lack of exercise. It means never doing physical exercises, being lazy as we're doing now. I'm sorry for this. And alcohol, drinking alcohol. Drinking alcohol is a very bad thing. We all know that alcohol is not a good thing to do, and even as a Muslims.
Hormones replacement therapy during menstruation. The menstruation is the thing that happens to any girl in a year. It's difference from girl to another.
It's your period.
There are some girls who it's not so regularly, so they take hormone therapy. This hormone therapy can affect your body and maybe it can cause breast cancer.
Yes.
Ionizing radiation, especially those people who work in the clinics of ionizing radiation. Ionizing radiation are so dangerous for our bodies. Like doctors who work with radiations, they must be so careful to their health and to their body.
Yes, early age at first menstruation. So girls, like some girls get their period for the first time at age of really like
old,
early, like 9 or even 8. So those girls could have breast cancer in the future.
We have having children late or not at all, like becoming pregnant at a late age, 40, 41, 42, or never become pregnant, to never have children. That is a cause of breast cancer.
Older age, which means like not teenagers like us could have breast cancer, only like women in late ages.
50 years old, 51
Older,
years old, and something
yes.
like that. Rare breast cancer, especially the women who had suffered in the past from breast cancer, and even though they had recovered from it, they can appear again for them after 10 years old, 10 years, 15 years later. And the family
history, if your
depends
mother
on
or
genes.
someone of your family has breast cancer
Your mom,
before.
your grandma, your auntie.
Yes.
It can affect you. And Klinefelter syndrome, it's a syndrome or a disease that is connected with genes. And we don't need to talk much about it.
Then treatments. Every disease had its own treatments to get rid of it. So first of all, surgery, which is you can do surgery and like get rid of it exactly and like super fast.
But it has some
benefits and also
it's dangerous somehow. And radiation therapy, and we all know that cancer can be we can get rid of it by radiation therapy, and also chemotherapy, hormonal therapy, and targeted therapy. That means we are giving the therapy on the new body or on the cancer body.
Yani that means if we have like a cancer breast, the breast is our target. Okay?
Not all the body, just the place with the cancer.
And the goal is to get rid of the cancer from the breast, exactly from the breast.
The frequency?
2.1 million affected as of 2015.
That means 1 million women and men, but we say that men has so low rate,
yes.
But it's a very huge number.
Yes, it is actually. Deaths. 533,600 in 2015
had it because of the breast cancer.
Yes. And now
the prevention. Prevention is the most important part in all our presentation, is the prevention, and it's actually our goal.
Yes, our goal today is to talk about it.
The lifestyle.
Women can reduce their risk of breast cancer by...
They are actually the opposite of the causes of the breast cancer. Maintaining a healthy weight, so we can have a good weight, not to get too fat.
Reduce alcohol use, to never drink alcohol.
Increasing physical activity, we can go walking, jogging, running, an hour every day, 2 hours every month, it's enough actually.
Breastfeeding, which means that to let your baby feed from your nipple.
To never
feed your baby.
To never go to the industrial milk. And
yes.
It's actually dangerous for you and for your babies. So breastfeeding, it can prevent you from having cancer breast.
Yeah. And high intake
of citrus fruit. You know, I have known that information since I was 5 years old. It says if you eat a half of lemon every day, you can prevent yourself to have cancer breast when you get older.
Yes.
And that means citrus fruit can prevent you to have breast cancer.
Which means a lemon every day, keep the doctor away. Breast cancer awareness.
The breast cancer awareness means that we want you all to know the causes, the risks, the signs, and the treatment of breast cancer. And also the symptoms and the treatments are easily to know and easily to be done if you know it and if you have enough knowledge about it.
So when you do check for breast cancer, you're not doing it only for you. You're doing it for your family, for friends, for everyone who loves you. You're doing this checkup for everyone who loves you to always be safe, because this disease is really dangerous.
It's evil.
It's really dangerous, guys.
Then the being crippled.
Yes, this
is the symbol of the breast cancer, and our cause of choosing this topic is that we are in October month and it's the National Breast Cancer Awareness Month. So we are in this month, we are in the month of the breast cancer. You are noticing that this dangerous cancer has its own national month. That means how it's dangerous and how we are important too.
Yes. So this is our topic today. I hope you learn and get the benefit of it. Thank you so much for listening, and we enjoyed this with you guys. Thank you.